Hi guys, my name is Dr. Armando Iannicello. I'm one of the attending physicians here at Unique Pain Medicine. Today we're actually going to talk about runner's knee. Okay, so this is a very common cause of knee pain, especially in the younger population. Women are typically more affected than men. The other names for this disorder, it's a group of disorders actually. Some of the other common names are chondromalacia patella and patellofemoral syndrome. What this is an overuse injury, which means the more that a certain activity is done, the more pain and symptoms a person will have. Typically, someone will be doing a lot of vigorous activity with jogging, squatting, climbing stairs, and these things will cause pain kind of in the front of the knee, around the kneecap area. Some things that can predispose a person to having this are certain hip alignments and knee alignments, as well as imbalances in certain muscle groups, such as in the quad muscles. Symptoms people will have are pain with bending the knee, climbing stairs, jumping, squatting, bending on their knees, and that will get worse the more that certain activity is done. So this is best treated with stopping that certain activity that's provoking the pain, rest, ice, compression, elevation, and anti-inflammatories if needed. If this sounds like something that you're dealing with, come on in for assessment and we'll take care of you.